you walk, do it, but just a little bit of a stretch before and after. But it's actually good for you to move anyway. So I'll get you standing and you can face away from me. And you can pull the shoulders back. But that's amazing, you know, the fact that you're able to hike on Hoth. Nice, and you bend forward towards your toes as far as you can get. That's better, isn't it? And back up for me. And then spin around. Just with the back actually, that's it. So that's a little bit tight still in extension.
It is,
and how the stretch has been going?
I missed just one evening.
Oh, top marks! A star! I need to get you a trophy. Usually when I ask people, they're like, what stretches? Relax your arms for me, pull back. Nice. So what I'll do is get you lying face down, please.
Yeah.
Head in the paper. Oh, well done. But like, they do help a lot, don't they? You know.
Yeah.
Super.
You should see me at 5 o'clock in the morning down on the floor.
Nice. I'm still dreaming at that stage. So what we're doing here, just as usual, just checking for the leg length balance, the quality of that leg length. It's always a good indicator. But yeah, percentage-wise, you know, it's definitely pushing on the fact that you're able to get up to Hoth and do the hike. I mean, that's really, really positive, isn't it? You know, again, like with the leg pain reducing as well, that's an important aspect of that sciatic nerve reducing out. So just checking hip flexor there, hip rotation, always really important when we're looking at the back, because as we've talked about, you have your lumbar spine, low back, pelvis, and then your hips. So when the low back meets the pelvis, this is where we see most low back issues, and a lot of the time people think they've got a hip issue when it's actually a pelvic issue. Super. So what I'll do firstly is just start to set the pelvis right around the lower disc with the blocks, so you can raise your hips, nice, and drop. But yeah, you're doing really well. You know, I'll just go through a couple of the stretches with you again. But like we talked about last time, you know, it's a lot less inflamed, there's a lot less pressure on that lower disc and nerve, which is the biggest step forward, really.
So the progress is still there?
Yeah, it's every week you come in. Yeah, it's amazing, really. It's great to see that improvement, because like you said, the starting point obviously was terrible with the pain medication and everything that you were having to take, and being able to be back in work as well. That was an important step, because I think last week was your first week back, wasn't it? Yeah, and it actually went quite well as it went. Yeah. So we're just in the glutes, a little bit of pressure. That feels okay? Yeah, good. And then we'll bring in a little bit of rotation. And we come up and down. And how was work this morning?
Busy.
Yeah, the hospital's busy.
It is busy,
yeah. Days go faster, don't they?
It does, yeah. By the time I'm back now, I'll have 3.5 hours left. And
that's easy, isn't it? Yeah. It's the home straight then.
Oh yeah.
Good stuff. So we're going to adjust into the L5 sacrum level here. So I'll get you lying on your side, facing me. Nice. And then we'll get you set up nice and comfortable as usual. And then we'll drop. And then come around. Fantastic. So you're nice and comfortable? Yep. Feels good? Good. And then we just get the pressure right on L5 sacrum. And then you just feel me lean in as normal. And then we come down. All done. And a nice easy adjustment. Again, like the difference there is fantastic. So then we'll switch over onto the other side. And then across. And then we'll come on in. But yeah, well done on the stretching. You know, that's really helping through the week. So that's into L5 now, so we're going for a little pull on L5, where the first adjustment was through the sacrum, because that's where the disc and the nerve's being compressed. And then just there. Well done. Onto your back, please, face up. I'll just recheck that. Nice, straight leg raise. Them hamstrings are amazing. I told you that before, didn't I? They're like twice as good as mine. And I've got a good back, you know. But that's really important longer term, because the hamstrings insert into the back of the pelvis. So it's a very classic one tight hamstrings do put the back under more pressure. Super. So coming through the shoulders and upper back. So if you take a breath in and just feel that there and relax. Nice. Well done. And then you can relax your arms down. So just this is like something else we've been taking care of whilst you're here, just some of these longer term kind of pressure points in the neck where you've had the disc issue in the past. So right there on the right, you just look at that range. It's actually moving, the global range is good, but like specifically then, as we come into that segment there, this is where we'll just put that light adjustment through as usual. Well done. And that was nice and easy. How did that feel?
Great.
Yeah, it's super soft, isn't it? You know, a lot of the time it looks and sounds harder than it actually is, but you actually don't feel much with that. So get your face down, please, onto your stomach. And how's your sleep been?
Good.
Yeah, super. And when you wake up in the morning at 5,
I'm
apart from tired,
I'm a bit stiff
Yeah.
now, but then I start to move and I'm fine.
yeah, super. And then just holding that might be a bit tight. That doesn't go down to your leg at all, does it?
No.
Yeah, super. And then we're going to use the drop piece. So as normal, loudest bit of work we do, but it's the softest. So we're just going to rest on the sacrum, and then we're going to pull down the left side, coming down towards that left foot. Well done. So again, when we're thinking about that disc compression, that nerve trap, and that muscle compensation, these are all the aspects we're taking care of today. Checking all the range, all the motion. And testing that, which is starting to really become a lot more balanced with the right side, you know, with your better side. This is where the spine comes down and sits on the sacrum, so it's the foundation. So most people with a low back issue and a lower back and disc issue have a very kind of similar pattern with how that balance is. This side's much clearer. Super, so just do a check. You can raise this straight leg up for me. So straighten, so straight leg. Super, hold and stop me pushing down. Push up, push, 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 nice, and drop. And then if you push the leg out, that's it. Nice, very, very strong. So that's a good sign. Super. So you can take a seat for me. And we'll just have a little look over your shoulders, either side, whatever suits you. Yeah, like I said, you know, we'll probably keep it a week for the next couple of weeks. Like I said, that's all taken care of. Fall back. And elbows back. Nice. And cross the arms over. And then if you bring your chest down to your knees, so flex, flex, flex. Fantastic. So you can come back up for me. So yeah, you're doing really, really well. Like you said, we're giving the disc and nerve level time to heal, and that's what's happening with the pressure coming away from the disc, the inflammation. They said it affects all the levels, so all the muscles on top of this definitely have been compensating, but the problem being like that deeper level when we look at the disc, muscle, nerve, and that complexity of that balance, you know, that soft lordotic curve. And that's the hard thing with working. You know, we're constantly using the back, so when it's irritated and inflamed and not getting the breaks, that's why what's great now is you're still kind of taking your time a little bit. So well done with that. And the stretching,
Yeah.
well done. All right,
Yeah.
so yeah, I'll take you on through.